Every day, cholera treatment centres receive close to 2,000 patients, as Haiti still lies prey to the cholera epidemic that broke out in October and which has so far killed more than 2,000 people. Médecins Sans Frontières remains very alert and very active. The organisation's teams have treated 62,000 people in 47 cholera treatment facilities across the country. The number of cases in the Artibonite region, where the disease first broke out, is decreasing. At the beginning of December, post-election violence in Port-au-Prince led to road blockades which prevented trucks carrying safe water from reaching the city. This could explain the recent increase in the cholera cases in the capital.
We have a large proportion of the population who no longer had access to water for these days, and we've seen a significant increase in the number of cases reported of cholera, obviously, in Port-au-Prince in the past few days. And then the other changes in the south, where there really had been very few cases reported over the last 2 weeks, really, there have been an increase in the number of cases, and it has already spread also into the rural areas of the south, where you have very low population density, but we're having reports of high mortality in small villages. So it's going to be a challenge to be able to help those populations.
In the north, the number of cases has stabilised in the towns, but continues to rise in rural areas. The main challenge for the teams is logistics, as many places are difficult to reach, like here in Zabricote.
La difficulté, c'est qu'on est à 2 heures de route de Port-de-Paix, à peu près un quart d'heure de.
The problem is that it's a 2-hour drive away from Port-de-Paix. We're also about a quarter of an hour from Saint-Louis-de-Nord, but there is a large river to cross. So the people sick with cholera have a hard time reaching the treatment centres. The situation was very serious, so we rapidly put up a tent, and today we've been able to start treating and settling patients inside the tent.
To improve access to care, Médecins Sans Frontières regularly sets up new cholera treatment facilities. Treating severe cases, setting up rehydration points and distributing chlorinated water remain the priorities. In August 2010, torrential rains swept across Pakistan, costing many lives and causing extensive damage in just a few days. Médecins Sans Frontières responded rapidly to provide assistance to victims of the floods. In total, MSF staff conducted over 80,000 medical consultations and every day distributed more than 1,800,000 litres of clean water. 4 months later, Médecins Sans Frontières is still running flood-related activities in southern Pakistan. In other regions, MSF pursues projects set up before the natural disaster, as is the case in Hongu Hospital, where MSF has been running a medical and surgical project since last May. In the last 3 months, 5,600 patients have been admitted to the emergency services.
We feel that the MSF presence here is valuable and it's warranted and it's highly relevant. There are no other NGOs active in the field. Our main brief is to set up emergency surgery services and to have a 24-hour viable emergency room service for the town.
Hongu lies in a volatile region with clashes between armed factions and tension between religious groups. Ensuring the safety of patients and medical staff is a major challenge. In order to achieve this, the teams have had arms banned on hospital premises. A third of patients are admitted for trauma, knivings and bullet wounds, as well as road and domestic accidents. A gynaeco-obstetrics centre is due to open in Peshawar in March 2011. June is the start of the rainy season in Ethiopia. Here in the east, not far from the Sudanese border, the land has become a vast swamp. In the western part of the Gambela region, the roads and fields are flooded and the population left isolated.
This region is very remote. The population of Wantara Warada is 25,000 people. The majority of those people live in remote rural areas.
Médecins Sans Frontières is providing them with medical assistance through mobile health clinics. Usually the teams travel by car, but during the rainy season this becomes complicated. It takes 3 hours to reach the village Chikau by boat.
Because of the travel time is so long, our actual consulting time in these communities is limited. We're usually present 4 to 5 hours. So our clinics are fairly busy.
The teams generally see about 100 patients a day. For some, it's their first medical consultation ever. They often present illnesses related to their living conditions: diarrhea, malaria, respiratory infections, and a few cases of malnutrition. The most severe cases are transferred to the health centre in Mata, where MSF has been working since December 2009. November 2000, the end of the Second Intifada. For the people living in the Gaza Strip, daily life became strongly marked by the Israeli occupation, violence and military checkpoints, factors which also had an enormous effect on the healthcare available to them. Médecins Sans Frontières set up a psychological care project with teams making home visits to patients suffering from depression and post-traumatic shock.
There's firing day and night. She says the children's father thinks it would be better to kill his children so they don't have to suffer these things.
That was just the beginning of a decade of action. 10 years marked by the gradual deterioration of the health services available. In May 2007, inter-Palestinian fighting in the Gaza Strip caused further disruption to the health system, and many of the injured were discharged too soon. MSF decided to open a medical treatment program.
A lot of the injured ended up with orthopedic complications because they were discharged from the hospital very early on after their operation. They were sent home or to non-hospital facilities where they had no access to physiotherapy because at the time the physiotherapy services, or most of them at any rate, were closed.
The embargo set up by Israel was reinforced in 2008, paralyzing the economy in Gaza. In December, the Israeli army launched Operation Cast Lead. In 3 weeks, the fighting left nearly 1,300 dead and more than 5,000 injured. Immediately after the ceasefire, MSF brought in 21 tons of medical material, including 2 inflatable hospital tents. The teams focused on specialized and secondary surgery.
Many of our patients who were operated on in public facilities during the acute phase of the conflict needed reoperating or follow-up surgery. But the health facilities in the Gaza Strip were totally inundated. So we tried to fill that gap and relieve the health system by taking in patients.
Today, MSF is running 3 projects providing psychological care, rehabilitation care and reconstructive surgery, a broad range of medical activities set up in response to the population's needs. Although eased recently, the blockade continues to take its toll on the healthcare system in the Gaza Strip.